Fertility being, it's not only a medical problem, it's also a social problem, because it's not like any other disease where only you just get treated, you are given some medication and you are done with it. But with fertility, the problem is it's also taboo. Suppose when women or a couple who suffer with fertility, they have a lot of social stigma as well. So the first problem that we face with these kind of situations in fertility problems are like the lack of awareness, because even educated people, it's very difficult to find people who are really aware of their problem. That's one thing from the patient's perspective. From the doctor's perspective, it is like sometimes the lack of technology in the rural areas, where people, even majority of the population lives, still they cannot access the fertility health care. So that is something, and affordability still is an issue, but when it is spent on the right treatment with the right doctor, I think that should not be the major hurdle. See, we really do good work. It doesn't, because there's a lot of research that still goes on, but everybody is busy, so they do not really publish it. But a lot of doctors are there who are really doing world-class work, even in India. There are, see, for everything there is always a second side of it. It doesn't mean like there is a lot of people who blame the fertility specialists that they have not been honest with them. But every doctor tries to be honest with their patients and try to explain to them what exactly is the problem. It's also about the acceptability of the couple for the treatments. Yes, because even till today, lot of people do not actually apply for any healthcare insurance, because that has never been a part of our ecosystem, healthcare ecosystem. So this, especially in cities, that's most of the times patients have this financial support in terms of this insurance companies. But when it comes to rural areas, affordability is an issue, because they cannot have any access to the insurance companies. So, but still, when insurance companies, the problem with them is, if we cite the reason as infertility, it is straight away rejected, because they don't consider it as a disease. So if we have to do any surgeries for them, then they straight away reject them, their claim, telling that it is not thing. So including them in the list of diseases definitely will help them to support us in some extent. Actually, I think government also should take up an initiative to provide at least healthcare insurance to these women, and to support insurance to these couples. Regulation policies, they are trying to put them in place, but I think they have to be more stringent, because there are a lot of things that are going which are not actually supposed to be done. A lot of quacks are there coming into place, and so many not even allopathic doctors. Everybody does fertility treatment, so there should be definitely be a guidelines to tell the people what it is right and what is wrong. So I think regulations should be still more stringent in the fertility healthcare industry.